I'm Dr. Brian Nickel, your cannabis expert for CannabisExpertMD.com, with part 2 of our series on post-traumatic stress disorder. In part 1, we kind of went through the diagnostic criteria for PTSD. I alluded to three different symptoms in particular we treat with cannabinoids as far as PTSD goes. And I'd like to talk today about the use of cannabis to help with the insomnia and nightmares that many PTSD patients experience. A very common symptom of patients with PTSD are sleep disturbances. Most patients have a difficult time falling asleep. In fact, a lot of them are apprehensive about going to sleep, particularly if they have nightmares. They'll find reasons not to go to sleep at their usual time. Maybe they're going to watch one more of a series on Netflix or play one more game of something on their phone. Maybe do a load of laundry. Whatever it is, they find a reason to kind of push off going to sleep in the evening. When they finally do go to sleep, if they have a nightmare and it wakes them up earlier than their usual time, most patients will say, well, it's only several hours before I have to get up. I'll get started on my day, start answering emails, do another load of laundry, whatever it is, in order to avoid going back to sleep so they experience the nightmare again. As a result of this, post-traumatic stress disorder patients are behind on their sleep during the day. When they're behind on the sleep during the day, their usual depressive and anxiety symptoms tend to be worse. The triggering events that they may experience are more likely to promote panic attacks on them. Panic attacks become more common. When it comes time to go to sleep again at the end of the evening, they're apprehensive about it. And it's one more Stranger Things on Netflix, one more game of something on their phone. They're in a very bad cycle here, and we're going to attempt to use cannabis to break this cycle up. Now, when we're using cannabis to help patients with PTSD and insomnia, I really direct them towards several strains in particular. There are going to be strains that are THC dominant and strains that are dominant in the terpene linalool. Linalool in mammals and human beings, of course, is very relaxing and sedating. So the combination of a high dose of THC with linalool will help most patients go to sleep. There's a more important reason we're using these particular strains, and particularly the high dose of THC, to help patients sleep at night. And that is because high-dose THC decreases the amount of time that your brain spends in REM sleep cycle. REM sleep cycle is where you do your dreaming and all of your nightmaring. If we can decrease the amount of time a patient spends in the REM sleep cycle, they're going to have fewer dreams, fewer nightmares, more restful sleep. When they wake up the next morning without nightmares, they're less depressed, less anxious. The triggering events are less likely to provoke severe anxiety or panic attacks. When it's time to go to bed again at night, they're less apprehensive because they know about something that is going to help them. They know they have the cannabis that will help them sleep. This very important component to PTSDs is affecting the nightmares and improving the sleep quality of patients. For these patients, again, I always recommend a high linalool strain. Off the top of my head right now, I'd point patients towards Glue Ball or Gorilla Glue as being a linalool dominant strains. I usually recommend my patients always use the inhalation route of administration, whether it's smoking or dry herb vaporization. As with edibles, it's very easy to overshoot the time that you're looking at rising in the morning, and you don't want to wake up intoxicated at 7 o'clock trying to get to work. So, for my PTSD patients with insomnia, I point you towards Gorilla Glue or Glue Ball in doses that are on the higher side of things. You don't want to just have a pull or two off your pipe, your bong, your cigarette dryer, vaporizer, whatever your delivery device is. You want to go over to the higher side of the dose range. If you stay on the low side of the dose range, that'll get you thinking about things and actually be counterproductive. So as I always tell my patients, slip over to the higher side to where you really feel intoxicated. That should help you sleep, should decrease the number of dreams you're having, and start working on breaking up this bad sleep cycle that PTSD patients are in at this point in time. I hope you found this useful, at least addressing one portion of the PTSD problem. The next problem I'm going to address is panic attacks. You never know when they're going to happen or how severe they're going to be, and it gives you a little bit of advice on treating those when they occur. If you're looking for more information on this, you can find this at our website, CannabisExpertMD.com. We're on Facebook, Instagram, Twitter, and YouTube under CannabisExpertMD, all one word. Dr. Brian Nickel, your cannabis expert. I hope you found this interesting, informative, and I look forward to addressing the next problem with PTSD in our next video.